With ADHD in adults, it's often split, I guess, into two main categories, that being the sort of the hyperactivity and the impulsiveness part, and then the inattentive, poor concentration and focus part. And usually people display symptoms in both categories, but in adults, the hyperactivity part tends to be less pronounced than when they were younger. More men than women are diagnosed, and probably the reasons for that are due to the fact that women display less of the kind of behavioural, impulsive, disruptive type symptoms that men do, and so often their symptoms aren't as pronounced. So it can be more of a challenge, but I do encourage any women that think that they might have this disorder to come and see me. The symptoms have to have been present lifelong, so you will have like a lifelong history of challenges and difficulties in these domains. So maybe when you were a child, you might have been getting in trouble constantly at school, not able to sit still, blurting out answers, interrupting, being fidgety, struggling to focus, constantly like shifting tasks, these kinds of things. And, maybe your parents might have noticed something, your teachers, but not always. So in adults, as I was saying before, the sort of hyperactivity part of it tends to quiet down, but it doesn't mean that, people with adult ADHD don't experience that kind of restlessness and that fidgetiness that sometimes is associated with ADHD. But symptoms can typically be things like struggling to focus, struggling to organise yourself and your tasks, feeling like your thoughts and ideas are jumping around all over the place. You may have difficulty like articulating and constructing your thoughts. You may be quite irritable. There can be problems with losing things constantly, misplacing things. You might get in trouble at work for not being organised and not managing your tasks properly. And there can be relationship issues as well. You can be quite impulsive. You can be you can interrupt people quite a lot. And that can cause challenges in people's relationships. And as a consequence of and particularly if your ADHD is undiagnosed, you can also have associated mental health disorders like anxiety, depression. And there are some mental health disorders that are very much associated with ADHD. So neurodivergent people may have higher prevalence of ADHD, people with epilepsy, Tourette's, dyspraxia, dyslexia. So what I would say to people is if you have any concerns, it's worth talking to friends and family, particularly people who knew you when you were small, see what they think about those types of symptoms, and then come and talk to somebody like me, and we can do some screening questionnaires. We can think about, the impact that the symptoms potentially have on your lifestyle, and then we can talk about whether whether it's worth going into further investigation into it and doing some more detailed questionnaires and testing. Treatments for ADHD are quite varied, so they tend to focus on the inattentive and lack of focus and concentration. So when we're thinking about pharmaceuticals for ADHD, those are the types of medications and those are the symptoms that the medications target. So the hyperactivity is not something that the medication tends to target, but the focus and concentration, the inattentive part, that's what the medication tends to focus on. And they tend to be what we call central nervous system stimulants. So they actually stimulate the brain and help people to focus, which is opposite to what they would do for people who don't have ADHD. They probably make people quite edgy and erratic if you don't have ADHD. We can also think about non-pharmaceuticals. So there are behavioural adaptations that people can make. We can signpost you to CBT specialists who can help you think about patterns of thinking and how you can change and alter patterns of thinking to better manage your ADHD type of symptoms. And then also here we prescribe more novel treatments like medical cannabis. So for people who've tried conventional pharmaceuticals and perhaps, they've either not worked well enough or perhaps the side effects were too extreme. So things like, insomnia and loss of appetite, loss of weight, these kinds of things. medical cannabis can be a useful alternative. There are some schools of thought as well that can think about utilising and manipulating nutrition to manage ADHD. So what I would say to you is, don't try to sort of manage this yourself by cutting out lots of different foods and having restrictive diets. It's best to talk to a professional about what types of foods might be impacting your ADHD, but you might have an idea already. Like, for example, certain types of fruits might stimulate your ADHD and might trigger it and make it worse. But there are definitely things that we can look at nutrition and diet-wise as well that can help